The impact of COVID-19 and the associated restrictions designed to thwart its spread has been deep and truly global. We have found ourselves isolated from friends and colleagues, worried about the safety of ourselves and others, adapting to the stress of working and living differently, coping with job loss and financial hardship, and grieving the loss of loved ones. The broader consequences have been profound. The United Nations projects that those living below the poverty line could increase by 580 million, and that hundreds of thousands of additional children will be at increased risk for experiencing domestic violence and early death. Researchers have also estimated that the direct cost of COVID-19 to the USA alone will be over $153 billion. Moreover, these impacts are disproportionate among those most at risk, including those living in poverty, the elderly, persons with disabilities, children, youth, and Indigenous peoples.
So when the alarm sounds, when the amygdala sounds the alarm, it sends brain leaping into life-saving superhero mode. In superhero mode, brain shuts down all non-essential departments. Well, they're not essential in immediate, everyday, life-threatening situations, but they're kind of important in everyday life. So things like the thinking, planning, dreaming department, digestion department, all get shut down. So this is great for those moments where we're faced with an oncoming car or a snake and need to get out of the way ASAP. But it's not so great for longer term or less visible stresses like a pandemic quarantine situation. Coping strategies won't take these emotions away, but they can help to reduce their intensity, to make that sad feeling smaller again, or whatever emotion it is that you're experiencing. And because they do that, they can help make life more manageable. One way to get a clue about how big our emotions might get and how quickly they might get there is to consider our starting point or our baseline. And we can imagine this by drawing a graph with stress going up the side and time going across the bottom. Towards the bottom of the graph is where we're feeling safe and coping with the challenges of day-to-day life. Then as we move up a little bit, this is where life's throwing a few more challenges our way. So we're still coping, but stress levels are creeping up. By the time we hit the red zone, we're feeling totally unsafe, no longer coping. Over time, you'll develop your very own unique coping kit. And it's challenging. It's really hard when we're worried about our family and we don't want, in turn, our family to worry about us. So one thing I would suggest is trying to find a person, whether that's a family member or a friend, that you almost make an agreement with that you can be emotional. You can share whatever emotions you need to over Zoom. And that you'll try and be brave with each other and sit through those times that might be uncomfortable. And that way you've got some outlet that you know you can rely on and come back to. And it's essentially creating a safe space for yourself. And I think a lot of what you're talking about there comes back to this sense of feeling out of control. And there's three things that I talk about that I find really helpful when uncertainty comes into the mix, and there's not knowing when this is going to end. And that's time limits and control and choices. So I think for your son, and to try and help him, one of the things is to try and come up with creative ways of putting a time limit on it. So when we don't have a clear fixed time limit for when quarantine is going to end or when certain restrictions are going to lift.
Inevitably, though, we feel a huge range of emotions, and that becomes even more so the case when something like this pandemic is going on. So for many of us over past weeks, we might have found ourselves feeling unexpectedly or expectedly sad. We might have felt quite angry or grumpy or irritated at times. And of course, many people are feeling very anxious and very worried. We might be feeling just plain out of sorts. Now, instinct when these emotions first come along can sometimes be just to ignore them. But we know this doesn't work, and in fact, ignoring them can lead to them becoming even bigger, bringing their friends along. And when that happens, we try and employ, say, more drastic strategies that might get rid of them quickly, but may have some other longer term consequences. So we might do things like drinking more coffee, eating more junk food, drinking more alcohol, or watching a lot of Netflix to try and distract ourselves and feel good in the short term. Now, although this does work in the short term, in the longer term, it can have negative consequences in that it tends to breed more negative emotions. So what is it that we should do? And what can we put in our coping kits here? First step to befriending our emotions is, of course, to learn their names. The trick is to try and catch these emotions when there's still irritation and annoyance so that we can manage them before they keep on escalating. One of the things that parents can really help their kids with in this space is labeling their emotions for them. So when you notice your child feeling an emotion, you can check in with them and say, I can see at the moment you seem to be feeling angry in this space, and your child can help learn in that way. Is that they have some kind of evolutionary survival basis for us. So they help us to behave in ways that will get us to survive. Now, sometimes this means taking action. Other times this means communicating to other people what it is we need. So sadness is one of those communication tools where we express through tears and withdrawal the need for help, and that can help survival. But for other emotions, it really involves this action tendency, which means that they spread to our bodies as well as our minds. And we see this in common ways that we refer to emotions. So, for example, we get hot flashes of anger. And what this reflects is the increased blood flow that we get in anger, getting us ready for that fight response. Or in anxiety and worry, we talk about having butterflies in our tummy or sweaty palms, both signs that the sympathetic nervous system is becoming more active as well. Anxiety often needs a little bit of gentle encouragement to be brave. One of the things that we often work on with people is around anger and irritation and learning how to spot that early.
Let's now talk about a few of the actual individual play activities that are common to childhood and why they're important for a child's development. So first we have social contingency play. So within the first few months of life, children start to engage in contingent smiling, which is in response to positive emotional expressions from people like their mothers or their fathers or any other humans for that matter. And what this does is it teaches children the dynamic to and fro of communication. It starts the process of them building a template for the basis of social interaction. And as we all know at the moment, social interaction is at a premium and is quite important. And this can then lead to important games like peekaboo, as we see here with these two. Moving on to object play. So what we have here is a little fella playing with some commercially available toys, but object play doesn't need to be with toys. It can be with any household items, for instance, or things that children find in the backyard, but please, safety first. Object play is important because it helps children develop manual dexterity, but it also helps them understand the physical properties of objects in the world. And pretend and social dramatic play is quite notable for its role in the development of many important and uniquely human skills. So it's related to children's understanding of their own thought processes, so their own minds, and how their own minds are different from other people's minds. And because it's inherently social dramatic or pretend play helps children develop and refine their social skills. And because it's also inherently creative, what we find is that engaging in this type of play is associated with creativity outside of this play context. Finally, physical play. Physical play has some obvious and less obvious benefits. So some obvious benefits include motor development, which promotes a healthy lifestyle. When physical play becomes games with rules, such as sports or sports-like activity, it teaches children rule following and, of course, then rule enforcing, for those of you who have played games for any extended period with children. Importantly, physical play is stress relieving, so expending excess energy through physical play promotes well-being. And in studies with animals, we know that engaging in physical play leads to the development of parts of the brain that are important for social functioning. Any kind of media in a child's life, there should be a rule for moderation. So if you're engaging in a lot of video games, then there's an opportunity cost there, and it takes time away from that child to do things like their homework or to do other things that are going to be important for, say, school. So that's the kind of common sense approach, I think, to games. Of course, they're enjoyable, but sometimes too much of a good thing can have a bad effect in other areas.
I guess, how can we rebuild and maintain one of the biggest things that this year has taken away from a lot of us, which is our capacity to connect with the people we care about in the ways we are traditionally used to doing so, which is mostly face-to-face. So when it comes to the impact of COVID-19 on our health, the most obvious impact is obviously on physical health. And of course, that's been devastating in many countries around the world. But we shouldn't overlook the impact that it seems to be having on our mental health as a population either. In Australia, Lifeline is experiencing its busiest time ever in terms of the demand for its services. And as Bruce highlighted earlier, some research out of our school at ANU has found that there is higher levels of depression and anxiety in the community than we would generally see at the moment. Interestingly, though, that is not actually to do with a degree of exposure to the virus itself. It's not necessarily the case that people who live in communities that have higher rates of COVID-19 are the ones who are experiencing the strain on their mental health. Instead, it seems to be the case that this impact on our mental health and our well-being is being driven largely by the measures we're putting in place to try and restrict the spread of the virus. So here is a graph of the frequency of the search term loneliness on Google right across the entire world across the last 5 years. And what you can see there is a spike beginning at around the beginning of March and peaking at a highest rate it has ever been by about 25% over the last 5 years around the middle of April, which is also when Lifeline services were hitting peak demand in Australia. These two things happening at the same time are not a coincidence. In fact, decades of research have told us that actually loneliness is one of the strongest risk factors for developing mental ill health right across the board. So this is really important for us to address as a community and to make sure particularly that the more vulnerable people in our community are being supported to stay connected during this time. Importantly, too, I want to add the caveat that this is not to argue against the need for social distancing measures. All the lockdowns that have been put in place around the world, they're responsible for preventing some really tragic circumstances. But it is to say that we need to manage these restrictions in a way that tries to mitigate or ameliorate as much of the mental health impact as possible. And the way to do that is by focusing on how we can stay socially connected. We should be looking for quality over quantity with our social connections and being kind to ourselves that we may not be able to reach ideal social connection right now under these circumstances. We should use whichever platform works best for us and be flexible and creative about how we do that. And we should prioritize our connections with social groups, especially those that are an important part of who we are. I think that there are multiple ways in which we can use online media. So if you are merely scrolling through your Facebook and comparing yourself to old school friends and feeling inadequate, then yeah, that's probably not so great for your mental health. But if we're using online tools to connect with our communities that we care about, then that's when it's going to be most likely to be beneficial for our health. And I think that's a big part of why we see quite contradictory results in the literature about whether online connection or face-to-face connection is better, because I think in some ways that's not the question that is going to get us a straight answer, because I think there are certain times when online tools are going to help us to enrich and facilitate connections which are sometimes face-to-face. And there are other times when it might replace meaningful contact or be used in a way that's about social comparison or in a way that kind of alienates us from others as well. There is some research, for instance, showing that online interaction can lead to radicalization and polarization of attitudes.